Bella's gonna show me some magic. I did. The other video got erased for some reason. My phone restarted. This is crazy water flowing off the Smagus from that shit that hit Central America. I strongly suggested other brackets and other things like that, but I'm not gonna strongly suggest anything anymore. Just sit back. These guys constitute, try to put together to make a 2x4 bracket for it, since it's now weight bearing. Let's see what she's talking about. She wants to use these on the top, in between the frame and the tarp, which we just found this guy. 9 milliliter. Nice and thick. Those big old crazy hailstones shouldn't be able to get through that unless they're like grapefruit and shit. Like something crazy happened down on the river. It started raining.
Minnesota. I'm 60 years old and my spouse is 58. I own a small pet care business,
went away for a second.
And our net income has been reduced by approximately 75%.
When we first started coming down, this
I've laid off all my employees, which is 4 total, and I'm doing all of the work myself, trying to make ends meet.
Another video.
Financially,
This
we
crazy
can
flow of ribble.
go a few more
This sky was
months.
clear. Now look like a
We
fire.
have some savings, but it's very tough.
Inshallah. Me and abuela, mama, be able to get this done. Tidy ho.
On Cap Radio 90.9.
Do it together.
And 91.3 Stockton.
Inshallah. Right, are killing me.
CapRadio.org.
My head hurts, man. My head hurts.
From California Rice. Shallow amount of water on Sacramento Valley rice fields provides twice the benefits. Use of the word sushi rice habitat for nearly 230 wildlife species.
Set up last night praying for them people, listening to the storm weather down there.
Support from UC Davis Health offering care.
Hurricane went from
specialties.
Category 5,
17 neighborhood clinics staffed by UC.
made inland at Category 4, and dissipated within 40 minutes down to 60-mile-an-hour winds.
I tell stories about how people stay healthy, mentally or physically, and what happens when
the winds here were crazy.
Care they need. I cover the latest breakthroughs in COVID-19 and the ways that trauma can affect people's health long term.
So we got to do some buttresses, and integration of what she wanted to do, and integration of what I see needs to be done with a mix of my stuff to her thing, where we do wire wrap mixed in, so we don't get no slack, and then stretch it over, but doing the frame proper up.
You're listening to The Takeaway. I'm Tanzina Vega. The 2020 election season will be the most expensive
Our frontal face
in US
over a
history.
wall, since we have
When
a
the dust
slope,
finally settles, the
the
total
wind
amount
like
spent on all
tunnels
of the
through the
elections
roadway
this
that we
year, from
cut,
the House to the
like
Senate to the
insanely, dude. It
President,
was like
will be
insane
about
last night.
$14
So
billion, according to the Center for Responsible
to
Politics, a nonpartisan nonprofit that researches
do some
that.
modifications.
Of that, $6.6 billion
Get here with a
spent
good
on the presidential
water
race
spec,
alone.
400 square foot.
Donations,
With the wind hitting like that from the side, man, that water weight,
and while the election is over,
that's crazy.
both presidential candidates are still asking for money. President-elect
pray
Biden and President Trump are
people are all right
emailing
down in
their
Central
supporters,
America.
asking them to dig a little deeper to get money to Biden's fight
There's
fund
already
and
another
Trump's
storm coming.
Election Defense Fund. Sheila Krumholtz, the executive director of the Center for
These
Responsible
people are gonna make one on this side.
Sheila, thanks for being with us. So I'm just sort of flabbergasted by the amount of money, $14 billion, $6 billion. Where did this money come from? We were flabbergasted.
Where does it go? You got all the homeless people in the world, and just the elections in America, you could end world hunger in a couple of fucking terms. o'clock. A couple of dribbles on us. Give us some mercy, Lord. The brackets and everything. Tell me what to do, boss.
Looks like we're raising a bit like a multi-story building. It's like a lab.
So, what do we do first?
Comes from masterminding.
Yeah. What do we do first? Getting bombed on. Gotta do it from the inside out. Move everything real quick. Hit dry spots. Fun. So, this is what not to do, folks. We're getting it. It was raining like shit. I charged up the drill. Yeah. Fireplace going, keep it hot. We got a big ass tarp, gotta figure out how to get it up over. But right now, she's reinforcing her stuff. So I was like, dude, that shit don't work. Woo! Love it. Yeah. See how those brackets you put on kept it from like flopping? You understand? Otherwise we would have had that shit on our head. Turmeric tea. Get the temperature up to 200. Main structural brackets up in place. Wonder Twins got this, man. Wonder Twins got this. Never fret, baby. All you can do is just push through or lay down. No, we don't do that. Make it where she would have took the Metcalf last name, baby. Things wouldn't be so hard. Coming together. Thank you, Lord.
Oh, it says burnt and cut and bagel.
Got the turkey bag on. Damn swim condom thing ripped. Turkey bags. What you know about them?
Get it done.
$702. Human intestines. Man. So thankful the winds ain't 100 miles an hour and stuff. We were just talking about. Mom was like, "How you doing, nurse from Argentina?" Like, oh, fantastic. Still working it, getting the core back up. About to pull this crazy tarp up, getting everything fashioned so we can semi-hoopty do it and then do it right. There's regalia. Slip it over your shoes if you need. Don't like your feet being wet.
I swear to God, I was like, oh.
see the bed frame behind you though? You see the couch frame behind you? You still have to do that to this wood frame that you made.
Light up. Oh my god.
You're like an oasis. We're water in the desert. Dude, I'm so glad the wind. No, this with the
I
winds.
want to hang out with you. It's so cool. Like, at least you would have tea going. I'm like, yeah, it's fantastic. You know, and shit. My husband and I are like, hanging this shit. We go one day to 500, the next day to like 200. It's like, where the 500s? What happened? I know what happened. That didn't happen. We need to take it out. What we did, we need to take it out because there's this real durable here now. God, are we always going to be satisfied and fucking let it be? I'm glad we did that. Yeah, I do.
Very dark winter ahead. Yeah, we in it now, sucker.
The weird really wondering what's up with her. To mention her and be like, hey, I have to prioritize our fucking safetyness and dryness and
Yep.
she's like, are you loving the container? I'm like, I haven't even looked inside. Like I haven't even walked around it yet. I've seen one like 45 degree angle from it and that's it.
I found it like
I haven't opened the door.
I found a tag. I think it says "Fuck America," but I'm not sure.
The what? It's what?
It says "Fuck America."
A tag?
Yeah.
It says Fuck America?
Yeah, I think.
In it? Or where?
Yeah. In it.
Oh, a tag. Like somebody wrote
Yeah, like a
the
tag.
door, the wall, or something?
Yeah. Like a Sharpie. No, a Sharpie on the sticker. It's either America or Mexico. It's like, you can't really tell what it says. It's either Mexico or America. One of the two.
Is it nice inside?
Yeah.
Do we leave in it? Not now, I'm just saying. Would you put a wood stove in it and fucking... Would it give you that feeling?
You feeling what? Being in a big metal box? With a wood stove? Yeah, I guess. Again? Yeah, I'm in a bunker.
And we're always going shit crazy. Or it's all fucking fake news and the Hmongs and fucking... We're going crazy. But that's a joke. The Hmongs are a fucking joke. They might be telling each other, go fuck with these people, and the way back home, go just fuck with these people. Is that a thing?
You hand me the bong and the tobacco can.
You're gonna take a picture and say like, stop, no, on the road there.
Yeah, that's what I forgot.
We're gonna put a sign that says stop. Oh, I have a sign that says stop. Jeannie has it. I'm gonna put it that says stop, and then I'm gonna put it down there that says not a road through. Not a road through, because we need to say that, because it's not a road through, people need to know. I'm gonna start getting county signs and fucking putting them, because if the county doesn't care. Nobody that comes around, it's been around for long enough, that knows the story of all this,
Oh shit.
other than Wesley.
The largest daily increase with over 13,000 confirmed cases.
To pick up the spoon.
Hurricane Iota made landfall on Monday afternoon on Nicaragua's Caribbean coast, an extremely dangerous Category 4 storm. Much of the city of Puerto Cabello has been left without power, with the roofs of homes and a makeshift hospital ripped off by heavy winds and rain. Iota is the strongest hurricane ever observed this late in the season. It hit Central America just days after Hurricane Eta devastated communities across the region, killing at least 150 people and leaving tens of thousands homeless. We'll have the latest on the Central American hurricane fueled by the climate crisis later in the broadcast. President Trump continues to refused to concede to President-elect Joe Biden. On Monday, Trump tweeted, Ohio's next Republican gubernatorial primary would be hotly contested if the Republican governor Mike DeWine publicly acknowledged Biden's victory. On Monday, Trump's campaign gave up major parts of its federal lawsuit challenging election results in Pennsylvania, a state Biden won by over 73,000 votes. Trump supporters also dropped lawsuits challenging results in Michigan, Georgia, Pennsylvania, and Wisconsin. Georgia's Republican Secretary of State says members of his own party are pressuring him to exclude legally cast ballots from a hand recount of November 3rd election results. Speaking from quarantine after his wife tested positive for COVID, Brad Raffensperger said South Carolina Senator Lindsey Graham, chair of the Senate Judiciary Committee, urged him to throw out all mail-in ballots in certain counties, and Raffensperger blasted Georgia Republican Congressmember Doug Collins for accusing him of capitulating to Democrats. Raffensperger said, quote, I'm an engineer. We look at numbers. We look at hard data. I can't help it that a failed candidate like Doug Collins is running around lying to everyone. He's a liar, he said. Georgia's Secretary of State said Georgia's initial count showed Joe Biden won by over 14,000 votes, a result that's extremely unlikely to change significantly after the recount. The New York Times reports President Trump has inquired about bombing Iran's main nuclear site in the coming weeks. Trump raised the issue during a meeting Thursday with Vice President Mike Pence, Secretary of State Mike Pompeo, and top military officials, including Christopher Miller, the new acting defense secretary. The Times reports the advisors attempted to dissuade the president, warning that a strike could escalate into a global conflict. But officials told the Times Trump may still be looking for ways to attack Iran or Iranian assets before this term ends. Thursday's meeting was held a day after international inspectors reported Iran's low-enriched uranium stockpile is growing again, following Trump's abandonment of the 2015 Iran nuclear deal. Iran is enriching the uranium at a level suitable for nuclear power plants, but not nuclear weapons. The New York Times is also reporting.
You take them to a power plant and you get nuclear grade. Reason why you have a nuclear power plant.
Has been opposed by some
You get nuclear grade, weapons grade uranium. Still getting it in. Getting the angle down in tension on the prefab. Got the things true now as best we could in the rain and all that. Putting these 10-footers, extra slash of the boiler got the other day to help get the angle for the water flow. Takes a while to figure this stuff out, man. Yeah. Been on since like yesterday.
I'm doing the dishes at the same time.
Right.
Water collecting.
Yeah.
Yeah, off bit. I'm not anybody. Right?
See, mamas.
We're gonna smoke some DMT when we're done, all dry and good with this.
Look at
Celebrate
that.
our birthdays.
So, I think I drop it down a little 2 inches. Maybe a
The
pin.
bracket is at end.
If I drop them down just a little bit more, like another inch.
Yeah, totally.
I just gotta take all them screws, put it all together. No, just the bottom. Well,
That's why you don't run them, right, baby?
oh yeah, I gotta take all that apart.
That's why you don't run them, right?
But you gotta see what's going on. I mean, the water's coming off good, because it is. This is 8. This is 8, and we got a nice. And we grab the tape. But I'd say we got at least a 16-inch gradient down, so we should get a nice. I'm gonna drop that end down. So I'm gonna have to take that bracket that you put there and put it on this middle one.
Okay.
And then take this one as such, but we'll lower it just a little bit so it's not flat. Because our middle is flat.
No.
We'll drop it by like, say like 4 to 6 inches.
It helps the push.
Yeah, that helps that whoosh. We'll do it like a 4 to 6 inch drop.
Beautiful.
Ooh, look at that.
Hell of a spa, huh?
You can't take us out, man. We love it. Earthy people love to wash it. Listening to the Beatles radio station. Loving life. We missed all this in the house. Oh man, Grandpa's been loving to see Grandma deteriorate and grow. It's the only way to break a house person and a house hippie. And now she knows how to build a house. Learning. Getting the roof pitch, the angle of that, all good. Document all this.
It's so much better when we get the boards to the board.
See. And because we're trued from the center, where these screw points and so forth are going in, you can mimic to replicate. You understand? Making it work. Gonna put the big tarp up tomorrow. Ooh, she got her plate out. Pile. She got her pile today.
So good. I would just fucking towel this whole place the fuck out. I'm telling you. I'm done with doing shit half-assed. This goes right there. Because I'm done waking up in the morning and being like, ding, 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 all that shit. So we're going to take all of that and put one slab right there.
Yeah, but there still needs to be more underneath there.
Yeah, I know. I'm trying it out. So.
Okay, alright.
One, right there.
So big tarp gonna go on tomorrow. When the sun's up, we can see. Right now I'm getting all the gradients. I'm gonna stay up like I did the other night. Or last night.
About what time
Watch.
people wake opens up? I'm staying up and fucking going and getting all the shit that we need to do.
That's why I woke you up this morning. Was like, hey, store opens at 8 o'clock. What are you doing? What you doing?
No, they didn't.
I'm trying to sleep.
That's your luck.
Okay.
No, they didn't.
There goes the hour. Talk, baby. Getting the wall back dialed in. Simple over matter thing. Got the angles. Got the fire. Got each other. Got spinach. Portia. Queso. Sausage. And no, the water did not do this. We did this ourselves while it was raining. Oh, no. Me and the kids. So, today, COVID started a year ago. For the Keep Space program. China and Wuhan. And escaped the lab. Still getting it in. Got the wall put up. Still working on the corner. Down this corner. All this is gonna make it real green. They're gonna dry us out. Smack us. Boy, they ain't messing around. I still got it just prepped for it to drain out. Turmeric going. Love you kids. Hope you're safe. I'm able to provide. And others. Thank you. Temporary wall up. Got drainage out the side. Pocket. Drainage out the pocket. It's all dry. Pocket. Time to dry out. Got some more turmeric. Eat my dinner. Deep fry. Still rocking. Steaming out the clothes. Spinach. The beautiful soul we met years ago when we used to be professional babysitting. Blessed to make this happen through. Turn the shop into our house into the shop, and now evolution. Give my prayers out to those that live in houses like ours that went through those tremendous winds. A hurricane, this is remnant for. Doing it. Gotta go see club. Crazy. Water falling from the sky. But the trees are harvesting and everything and all that fire retardant. Teflon in it and so forth. Aquifers and mudslides. Be all crazy. say I pray for those folks. Honduras and so forth. Struck twice now. Plasma, weaponized, scalarized energy, induced, other anomalies that are becoming too frequent, but people aren't paying attention. Made it through the night. Bella, what was it? Nope. She ain't messing with no big tarp. She wants to reconstruct. If we go to breaking this, even if we don't, she wants to put those, whatchamacallits, fire bucket. That was crazy. Made it. Ha-ha. That was crazy. I have to reattach this. This is how I made it through the night. Yeah. Gonna make the walls and everything semi-permanent. I want to do that. Whatchamacallit, tile stuff. But, she's always talking about a glass house, so I'll do the, whatchamacallit, things for a garden, or for a greenhouse. Be epic. See the stars and such. The snow. Started. Come with it again. It's alright. I modified the inside. Pushing 350. Boost. Everything heated up so quick. Once we got it in, get the inside. And we get another pair of boots. We're pushing past 400. Zero boost. And put all of the wood in. Circulating and reclaiming very nice. The chambers are interacting with each other. The plasmas and so forth. That's the exhaust coming into here. And these are boiling. Got that silver steaming. Gas. Good meth line and stuff. Cooler rings and all that. Doesn't matter really. Fire. Engines. Just that pulse. We're getting that. Because of the 86 flood, I can't sleep in the rain forever. Not because of the sound, but it just trips me out. I remember the wave, feeling like I'm getting my guts now. that next front row. Slab is more rain, probably. They gonna do during the day what they do in the night? That'd be crazy. They just get the news from the other day with the rain. I'm ready. Fire. There too. And Jing J. Right, that. I'm gonna put some wet wood in. 200 degrees. It's turbo. Another one inside.
After the Texas Attorney General
working
sued
for
to
Quiche,
stop and
make
order
money off the
closing
vaccine.
non-essential businesses in El Paso.
And then the human
a
trials
Texas
for
appeals
the
court agreed with the
SpaceX
challenge
health aid
Thursday,
things
which
in
allowed
Arizona and so
businesses
forth.
to open the next day. About 80% of El Paso residents are Latinx. The county now has
So many
10
shop
mobile
owners I know are
morgues to hold
not gonna be
bodies. Some prisoners
forced
are
to
being paid
close,
just
like
$2 an hour to move the bodies
were.
as the numbers of cases and deaths has
they'll show up
completely
and
overwhelmed the
bite to the
hospitals.
bark.
They are moving the corpses. A traveling nurse who worked at the El Paso University Medical Center spoke out about what she called a horrific scene for patients with COVID-19. In a Facebook video earlier this month, Luana Rivers also described a room she calls the pit, where she says patients were sent to die with minimal treatment.
They did not aggressively treat them as they should have. And according to their staff, the doctors at the hospital wasn't aggressive before COVID, but even with COVID. So I saw a lot of people die that I feel like shouldn't have died. Y'all, that assignment there broke me. I was put in what's called a pit. And in this pit was 8 patients, all COVID positive. My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag. The patients that we coded, we were not allowed to bag them because we would get too much exposure, which I hadn't seen. And because they were COVID positive, this hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. There's, out of all the codes that we had there, there's not a single patient that made it. Y'all, this, when I say this assignment here, like literally almost destroyed me. Like I called my husband from there, I called my best friend from there, and I just cried. And I just said, what I'm seeing here is just not right.
That's visiting nurse Luana Rivers describing a hospital in El Paso. Well, for more, we go to El Paso to speak with Dr. Emilio Gonzalez Ayala, a leading pulmonary disease and critical care specialist. Thanks so much for taking the time, Dr. Ayala, to speak to us today. If you can start off by describing the situation in El Paso, so extreme that the county administrator tried to put major restrictions in El Paso, and the governor prevented them from being implemented?
Yeah, unfortunately, we've been facing these decisions by the government of the state. And obviously, as you mentioned before, the mandate to close non-essential businesses has impacted us in a significant way, because we continue to see the surge of numbers in the hospitals, in the ERs throughout the city, and we're at capacity. We're beyond the limit where we can continue to admit to the hospital patients that come in critically ill, and we're flying them out directly from the ER to other hospitals in the state where they can be admitted and treated. We are keeping a large number of intubated, mechanically ventilated patients in the ER waiting for beds to open in the ICU. But sometimes these patients are too unstable and too critically ill to continue waiting there. So we need to make space for them by either moving the stable patients in the ICU or flying out the stable ones that are in the ER.
And Dr. Gonzalez, I wanted to ask you about also the situation in Juarez, which is off across the border, right across the border. It's often called the sister city of El Paso. It's actually, some people would argue that El Paso is actually a suburb of Juarez, which is such a much bigger city. Your sense of how the close relationship between these two cities has affected the COVID pandemic one way or the other?
Well, it's the same city in essence. It's called the Metroplex, Juarez, El Paso, and obviously we have a lot of patients that are U.S. residents and U.S. citizens that reside in the other side of the border, and they can come in legally, obviously, and request to be seen and treated in El Paso as their rightly citizens or residents. And obviously, we're seeing those patients come across the border. That impacts also our ability to continue to treat patients in the hospital. And they're at capacity as well. There's no place in Juarez, no hospital in Juarez that has available beds. So it's the same situation in essence.
Dr. Gonzalez, sorry, go ahead.
And this whole issue of the refusal of state officials to allow the municipality and the local officials to implement the kinds of restrictions on public gatherings and that you want to have. What's the impact of that on your being able to curb the pandemic?
Well, obviously, we are not going to be able to curb that surge in numbers without those mandates. Obviously, we're entering the influenza season, and we already are seeing patients presenting with both infections, with influenza and with COVID. Obviously, that doesn't help at all. We're pleading with the public to avoid visiting or bring in visitors during the holidays. Thanksgiving is in the next couple of weeks. We're asking them not to relax precautions and to avoid getting even their neighbors into their houses to celebrate. I think if we want to continue to celebrate these holidays next year, we need to sit out this one.
Can you talk, Dr. Gonzalez Ayala, about the rationing that we're hearing? We're hearing that the county judge, Ricardo Samaniego, has said that care is being rationed in El Paso hospitals. And can you talk about what that traveling nurse said? The horror of nurses working in the pit, leaving doctors not being able to go into that area or not going into that area, people just being left to die, and then prisoners being paid something like $2 an hour to move corpses. We're talking 10 mobile morgues that have been set up, all of this.
So I am in private practice. Although I have privileges at University Medical Center, I don't practice there. So I cannot speak to the situation at UMC. I haven't been there in a while. I am familiar with the Facebook video that this nurse posted. I know my colleagues in UMC and Texas Tech University Health Sciences Center, which staffs that hospital, very well. And I'm not sure that I can fully believe that account. These are very humane, very ethical, very professional decisions. I don't see that really happening. I doubt it, but I haven't been there. I can tell you that care is not being rationed in the private hospitals where I practice. yes, we're overstretched. We are having to receive help from FEMA with physicians, nurses, respiratory therapists, nurse practitioners. We're grateful that we're receiving this help to staff the hospitals and continue to deliver the care that we alone, the people that live here in El Paso, the physicians that work here in El Paso, cannot provide on our own without that help. But we are not rationing care. I mean, we're limited by the number of beds we have available, but we're not deciding who lives and who dies, and that would be unethical and illegal. So I don't see that happening at this point in the facilities where I practice.
And Dr. Gonzalez, I wanted to ask you about the as a frontline worker facing this pandemic. Not only the problems that you see at the state level, but also at the national level, when you find that the White House itself often makes contradictory statements to those of the health professionals at the Centers for Disease Control and the National Institutes of Health. Your sense of what the impact of these mixed messages from the political leadership has, the impact it has on your ability to work on the front lines?
Well, I think that the medical community has better judgment and understands that when, for example, Dr. Fauci speaks, he speaks for the truth, and I think we mostly follow his advice. He's an authority not only in the country but worldwide. And even though we have a lot of political coming out from Washington, for the most part, what comes out of Dr. Fauci and most of what the CDC puts out is good advice, and we tend to follow it for the most part. When I hear this political messaging, I filter out what doesn't make sense to us from a scientific or medical standpoint.
Can you talk, Dr. Gonzalez Ayala, about Thanksgiving and what this means for El Paso? What message are you putting out right now? And also, if you could talk about being a pulmonologist and what that means, the kind of deadly combination, if you could talk more about the flu as well as COVID.
Well, the message we're trying to send again is, please, to everybody, avoid celebrating in person. It sounds terrible. It sounds like a draconian measure, but we're asking people not to go and visit anybody. I'm following up with patients that have recovered already from COVID over the last few months in my office via telephone encounters, and I have a lot of patients asking, hey, Dr. Gonzalez, can I go and visit my relatives in Houston or my relatives in California? I'm pleading with them, please don't go anywhere, stay put, even though you already caught COVID and we assume you have some immunity, you can still catch another, virus. You can catch influenza. Stay put, don't go anywhere, and sit out this holiday so we can celebrate next year. Now, to the question of what it means to be a pulmonologist and dealing with this, I think that it's the experience that I had never been exposed to. We're seeing this go completely beyond the point where we usually see it with the influenza peak in the months of January and February, where we have, yes, a lot of patients waiting for beds in the ER, but never to this extent. It's way beyond. Never seen it before anywhere. And I've worked in Miami, and I worked in Houston, and obviously here in El Paso, I've never encountered these kinds of extremes where we're overrun with patients that are critically ill.
Well, Dr. Emilio Gonzalez Ayala, we want to thank you so much for being with us, leading pulmonary disease and critical care specialist. This is Democracy Now! When we come back, we go from El Paso, which is one of the hot spots of this country, to North Dakota, which currently has the highest COVID-19 death rate in the world.
Wow.
We will talk with a member of the Standing Rock Sioux tribe, and we'll go to Navajo
What's in the
Nation of
food?
Arizona, which is now going through yet another lockdown. Stay with us.
The other place like Arizona where they have their stuff on NASDAQ listed. This military grade weapon Geostorm, China. Year and a day since COVID started. Getting hit with hail. Drive safe, man. Pull over, honey. Pull over, babe. Let this blow over. Let this blow over. I'll exhaust myself pushing this off. Rather have you not be in danger. She left to go get that stuff. Thunder.
The Native American community there, of which you are.
Little thunder cell.
Thank you, Amy. Sure, I would just like to say that this has been a tough several months, just hoping that the government takes action. The state government, the way that they behave and the way that they react affects our people directly, mostly because we have some of the highest rates of the underlying conditions that make COVID-19 a deadly disease. And so we're having a lot of people perish. We're having a lot of death, a lot of hospitalizations, and it's affecting us in ways that is not widely known by the rest of America. We have very few years, we have about maybe a decade, maybe 15 years, where we have to save our language, our Lakota language, our Dakota language.
Good old firewood. Nice wet wood. Freshly cut. Slight break. Safe right, baby. Wind is crazy. Scare their eyes weather. Turn is crazy. 40 years old. Splitting wood. I love the patterns. Remaking bowls and stuff. Marks. Plates. This one. Plasma. You hear the skyquakes go off and then full ground. The jets fly over and see them.
Fatigue, it is real.
When you're in a state of not having work or something that feels purposeful or has meaning, the depression and those thoughts and feelings around that become more intrusive.
We take your questions on the mental toll of COVID and how to take better care
Alexander
of ourselves.
Chetsky.
Also, 2020 has been uniquely awful on several levels, including
Solar major
hurricanes.
minor.
This season has just been something that no one could have believed. Watching those hurricanes rapidly intensify in the Gulf is just crazy.
Those stories after the news.
Live from NPR News, I'm Jack Spear. The Senate has recessed for its Thanksgiving holiday break without reaching a deal on a new wave of coronavirus relief. NPR's Claudia Grisales reports negotiations remain stalled and Congress could end the year without a stimulus agreement in place.
The Senate has left for its holiday break and the House will soon follow. Both chambers will return for 2 weeks next month. Lawmakers are facing a critical deadline to fund the government before it runs out of money on December 11th. This as Democrats and Republicans remain far apart on a plan to approve another economic stimulus bill. Democrats are still pushing for a larger package in the $2 trillion range, while Republicans are budging from a dramatically smaller plan closer to $1 trillion. Both sides acknowledge that they may run out of time to reach a deal this year and may have to wait until President-elect Joe Biden takes office in January.
That's how
NPR News, Washington.
The nation's largest school district announced today it will be shifting to all remote learning. NPR's Anya Kamenetz reports New York City is part of a national trend of school closures due to the accelerating coronavirus pandemic.
New York City has hit a 3% average positivity rate on coronavirus tests. That's the benchmark Mayor Bill de Blasio had previously set for closing all public schools. An estimated 300,000 students who had previously been coming in a few days a week will be learning from home for the foreseeable future. While over half of districts in the country have been offering at least some in-person learning, that number is shifting rapidly as cases surge nationwide. Detroit Public Schools recently closed their doors, as did Des Moines, Iowa, Toledo, Ohio, Oklahoma City, many parts of Colorado, and the entire state of Kentucky. Anya Kamenetz, NPR News.
The U.S. Army says it has now completed an independent review of the climate at Fort Hood, where officials say it contributed to the murder of Specialist Vanessa Guillen this past spring. Army Secretary Ryan McCarthy, in a somber video, stressed a preliminary review of a report due out in December finds the Army's Sexual Harassment and Assault Response and Prevention Program, or SHARP, fell short.
It is clear we have significant work to do to regain our soldiers' trust in our sexual harassment, sexual response, and prevention program.
McCarthy said leaders of all ranks should be accountable for what happens in their units. Guillen's family says her killer had been harassing her, but she was afraid to report it. Despite the fact Democrat Joe Biden won Wisconsin by more than 20,000 votes, the Trump campaign says it will pursue a recount in 2 heavily Democratic counties. Campaign paying out $3 million to look at areas where it maintains without any produced evidence that the worst irregularities took place. State elections officials themselves have said there was no evidence of fraud or other wrongdoing. On Wall Street today, the Dow fell 344 points. The Nasdaq dropped 97 points. This is NPR.
It's 6:04 with Cap Radio News. I'm Drew Sanser. Sacramento supervisors have voted no confidence in the county's top executive. They also announced today that CEO Nav Gill will be put on paid administrative leave. Cap Radio's Nick Miller reports that Gill has been facing repeated calls to resign.
The issue of whether Sacramento County CEO Nav Gill should be fired wasn't on the Board of Supervisors' agenda yesterday, but that didn't stop residents from demanding it.
Good morning. My name is Paula Spano. I'm calling to have Nav Gill removed.
Paula Spano says she's a former public defender and law professor.
I left Sacramento County after 20 years because of the toxic environment of intimidation and discrimination against women, perpetrated by Nav Gill.
Earlier this month, 8 public health directors and managers sent a letter accusing Gill of sexism, racism, bullying, and disregard for public health. Last month, supervisors Phil Cerna and Patrick Kennedy asked Gill to resign after he presided over an indoor meeting where many staff did not wear masks. In a statement, Gill told Cap Radio he denies any allegations of wrongdoing but cannot comment further as it is a personnel matter. Based on this week's outcry, it's also a matter that won't be going away soon. Nick Meller, Cap Radio News.
2 top officials at the California Medical Association attended that birthday party at the French Laundry that got Governor Gavin Newsom in hot water. A CMA spokesperson says the group's chief executive and a senior vice president were at the November 6th dinner at the posh Napa Valley restaurant. Newsom has apologized for attending and said he made a bad mistake. California guidelines urge people not to gather in groups of 3 separate households or less. You can find more news at capradio.org.
Support for NPR comes from NPR stations. Other contributors include the Andrew W. Mellon Foundation, guided by the belief that the arts and humanities are essential to the well-being of diverse and democratic societies. Learn more at mellon.org. And the Annie E. Casey Foundation.
Ahead on All Things Considered, answers to listener questions about the toll the pandemic and isolation can take on mental health. That's coming up in about 15 minutes. This is Cap Radio. It's 6:06.
You can't wait. Patience. You're rushing.
From NPR News, this is All Things Considered. I'm Ari Shapiro.
And I'm Mary Louise Kelly. Chris Krebs is the latest head to roll in the outgoing Trump administration. Krebs led the Cybersecurity and Infrastructure Security Agency within the Department of Homeland Security until yesterday. Krebs received his pink slip after he confirmed, in keeping with election experts everywhere, that there were no big security problems in the 2020 election. Now, you will recall this follows the president firing Defense Secretary Mark Esper and forcing out other Pentagon leaders. So, is this chaos for the sake of chaos, or chaos with an agenda? To help answer that question, we have Garrett Graff on the line. He covers national security at Wired. Hey, Garrett.
Hi.
Hi, so start with the Krebs firing and its significance. Krebs' job, as we outlined, was protecting the election from interference, trying to shoot down misinformation. But with the election being over, was his work basically done anyway?
So CISA has both a defensive role with the states in terms of securing election systems, but also a big part of the work that they've been doing all year long has been combating disinformation and misinformation. And what has been clear over the last 2 weeks is that increasingly the biggest disinformation threat to the U.S. election in terms of undermining the legitimacy of the results is the president himself. And Chris Krebs had been increasingly vocal on Twitter and on the CISA website and in public remarks about debunking the president's own baseless allegations of election fraud.
Yeah, and he had telegraphed himself that he feared that his job might be on the line as a result. But to the question of the impact, and let me sharpen that question, the impact on the Department of Homeland Security. I mean, I'm thinking in contrast with the ouster of the Defense Secretary at the Pentagon. You know, the Pentagon is a machine. It is trained to keep on churning no matter what. The Department of Homeland Security is a much newer department, and they have had no permanent leader, no Senate-confirmed leader for a while. So what is the impact of this kind of upheaval?
So it's not insignificant, and particularly with CISA and particularly in the midst of a pandemic. The infrastructure security side of CISA's mission, in fact, focuses on securing the healthcare sector. They've been actively engaged in fighting the scourge of ransomware that has been hitting hospitals and healthcare networks across the country as they tried to deal with critically ill COVID patients. And of course, CISA has a role in defending and protecting the intellectual property and supply chains necessary to support the development and distribution of the COVID-19 vaccine. So this has real public health and national security implications within a department that is deeply struggling with a leadership crisis. DHS writ large has less than a third of its Senate-confirmed positions filled right now. And in fact, it's not really sure who is legally in charge of the department. There are a lot of questions about whether Acting Secretary Chad Wolf was properly installed. And over the weekend, DHS actually secretly appointed FEMA Administrator Pete Gaynor to be the acting secretary briefly to ratify the selection of acting secretary Chad Wolf as the correct secretary. And you know, legally they can't really prove in court right now who is in charge of that department.
Okay, so a lot of uncertainty hovering over the Department of Homeland Security. Telescope out a little bit, just big picture. What is the effect of so much change of all these shakeups being implemented during a transition period?
We've never seen anything like this, Mary Louise, and it's important to think of the federal government and sort of what it projects to the world. There are really sort of three legs of security and stability that the U.S. government at its most basic level tries to focus on. You have the Department of Defense overseas, you have the Department of Homeland Security at home, and you have the Treasury Department focused on the U.S. economy here at home. There are big leadership crises in two of those departments, and the Treasury Department faces a pretty uncertain next couple of weeks as the federal government runs out of money on December 11th.
So just in the few seconds we have left, do you think this chaos will ultimately amount to a few weeks of chaos and then we'll move on, or do you see more enduring consequences?
There are certainly more enduring consequences that we face here, because remember, the GSA has not officially declared Joe Biden the president-elect and allowed him to begin the formal transition process. Every hour and every day right now is making Joe Biden's role of taking over this job on January 20th at noon harder.
Garrett Graff, he covers national security at Wired. Garrett, thank you.
Always a pleasure.
The FAA is clearing Boeing's 737 MAX to fly passengers again. The plane has been grounded since 2019 after the second of two MAX crashes that killed 346 people. Investigations found not only design flaws, but what some call a pattern of deception at Boeing and grossly insufficient oversight by the FAA. NPR's David Schaper reports that's led to scrutiny of the process of recertifying the MAX.
For Nisha Ryan, the pain of losing her husband in the crash of an Ethiopian Airlines flight 20 months ago is still as raw today as it ever was.
The day of the crash, the day Nick was killed, part of me died also. Our family is broken.
Mick Ryan, an engineer with the World Food Program, left behind Nisha and two young children.
Because of the actions of Boeing and the FAA, we have been handed a life sentence. We are suffering and will most likely continue to suffer for a very long time.
Ryan calls it sheer incompetence, negligence, and a culture of concealment that led Boeing to develop a new plane with a critical design flaw and withhold information about it from the FAA. She and others also blame the regulators for not grounding the 737 MAX after the first crash in Indonesia. Michael Stumo's daughter, 24-year-old Samia Rose Stumo, was killed in the second crash in Ethiopia.
They say trust us, just like before. We cannot trust this plane.
But FAA Administrator Steve Dixon insists that after what he calls a comprehensive, methodical, and deliberate review process over the last 20 months, the 737 MAX is now safe to fly passengers again.
This airplane has undergone an unprecedented level of scrutiny by the FAA. We have not left anything to chance here.
The design flaw was in an automated flight control system, which, based on data from a single faulty sensor, repeatedly forced both planes into nosedives. Boeing says it addressed the problems with software fixes and by adding redundancies. And Administrator Dixon, former Delta Airlines pilot, recently flew a 737 MAX himself to put Boeing's revamped system to the test.
The design changes that we have overseen make it impossible for these accident scenarios to reoccur.
Dixon says he was planning on talking with the families of those who died in the 737 MAX crashes later today, adding that he can't imagine their pain.
I mean, it's incomprehensible to me for that to happen. So it has motivated us to leave no stone unturned, but I am fully confident that the aircraft is safe, and I would put my own family on it.
The fact that the FAA initially certified the MAX with a flawed design frayed relationships with fellow aviation authorities around the world, many of whom are no longer taking the FAA's word on the aircraft's safety and are conducting their own reviews. But regulators in Canada, Europe, and elsewhere now say they too are satisfied with Boeing's revisions, and may soon also allow the jet to return to service. But will travelers be confident in the safety of the MAX?
We're very cognizant of the fact that there may be some trepidations or questions about it.
John Weeks is a 737 pilot and president of the Southwest Airlines Pilots Association. And he says he understands that passengers may not want to board a MAX.
The ultimate litmus test is if a Southwest pilot is flying that airplane, they can be assured that they are safe.
Still, it may be a while before any MAX plane is flying passengers. With the planes parked in storage for almost 2 years now, they'll need a
Press inside each nostril and stir the sample into a little vial that snaps into a small plastic device. Within about 30 minutes, a light flashes either positive or negative. And Dr. Gary Prokop at the Cleveland Clinic says it looks like it's very accurate.
I think it's a pretty big deal. I mean, it's the first molecular test that was approved for home testing. So, I think that's a big deal.
Until now, the closest thing to a home test were kits that let people collect a sample at home, but they still have to drop it in the mail and wait to hear back from a lab. Most people still go to a doctor's office, hospital, clinic, or maybe one of those drive-through testing sites.
When you see these long lines of folks that are, sitting in line to be tested, this would be another option for folks that would like to be tested who are symptomatic in the outpatient setting. So, they don't have to be in those long lines.
Other experts are also welcoming the new test, but they caution that it has some big drawbacks. The test still requires a prescription, and while it's probably only going to cost about $50, that's still too expensive to let people get tested over and over again, quickly and cheaply at home.
This test is not a game changer. I don't think so.
Dr. Michael Minna is an infectious disease expert at the Harvard T.H. Chan School of Public Health.
It's a baby step of baby steps forward.
A baby step because the test will only initially be available on a very limited basis at clinics in Florida and California and won't become more widely available until the spring. Even then, Minna says, it probably won't be available in the millions really needed to stop the virus from spreading. Rob Stein, NPR News.
You're listening to All Things Considered from NPR News.
It's 6:18. This is Cap Radio, 90.9 Sacramento and 91.3 Stockton, Modesto, your NPR station.
Dating major hurricanes, including Hurricane Iota, which hit Central America this week. It's impossible to talk about what's happened this year without talking about climate change, and Rebecca Hersher from NPR's climate team is here with us. Hi, Becky.
Climate change, dude. Let's talk about
the records that this year has already set, remembering that hurricane season is not yet over. What are the numbers?
The elephant in the room.
Yeah, we still have a couple weeks to go, but even now, before the season is over, there are already new records. So, as you pointed out, 2020 has already had the most named storms ever recorded. That includes hurricanes and tropical storms. And of course, those that did become full-blown hurricanes, there are 6 of those that have hit the U.S. That is also a record in its own right. And if we focus on the most recent major storm, Hurricane Iota, that also set a record. Iota is the latest Category 5 hurricane ever recorded. Usually by this time of year, really powerful hurricanes are a lot less likely. And I should say, storms can form after hurricane season officially ends at the end of November. The Earth doesn't really care about the calendar.
So put this into context for us. What's going on? How does this fit into global warming and climate change?
Well, it's all about the warmer water. The oceans have soaked up the vast majority of the extra heat that's trapped by greenhouse gases. So ocean temperatures are rising, and that includes the water near the surface of the Atlantic, the Caribbean, the Gulf of Mexico. The water there is significantly warmer this year than it was on average 50 or 100 years ago. Here's the thing. Heat is energy. It's the energy that storms use to get big and to get dangerous. So more heat in the water means more chances for these big, powerful storms to form.
Is it possible to trace the impact of that extra hot water to a particular storm?
Yeah, and you can see it in different ways in different storms. So some of the early storms this year, they dumped a lot of rain. So Isaias, for example, there was a lot of flood damage. And studies have tied extreme rain directly to hotter water that helps storms suck up more moisture. Another thing is rapid intensification. That's when a storm's wind speeds increase really fast. by at least 35 miles an hour in 24 hours. It happened with Hurricane Iota. It happened with Hurricane Eta, which hit basically the same place a couple weeks ago. And I talked to a climate scientist at the National Center for Atmospheric Research about it. Her name is Rebecca Morse.
This season has just been something that no one could have believed. Watching those hurricanes rapidly intensify in the Gulf is just crazy.
Here's the thing, rapid intensification, it's not that common, or it wasn't that common. But climate models suggest that climate change could make it more common because of hotter air and hotter water. And this year seems to be a textbook case of that. There have been 10 storms that rapidly intensified this year.
Well, if climate change means these trends are only going to get worse, what does all of this mean for people who live on the coast in the potential paths of these storms?
Right. On one hand, it means that for people who were born and raised in hurricane-prone areas, maybe they've survived storms in the past, but the storms that they're facing now or they might face in the future are more likely to be really deadly and destructive. It also comes with mental health impacts. You know, as storm forecasting gets better, it also means that we know, when a storm is headed for land, days in advance, and that's good, right? It helps people prepare. But it's also exhausting, especially in a year like this one, when people along the Gulf Coast were on alert for basically months. And it's also really expensive. You know, as of October 7th, there have been 16 climate-driven disasters that caused at least $1 billion in damage. That is tied with the record. So climate change is really expensive, and hurricanes are a big part of that.
That's Rebecca Hersher of NPR's climate team. Thanks for putting this into perspective for us.
Thanks so much.
In another sign of the surging pandemic, New York City announced it will close schools for in-person learning as of tomorrow. For those keeping track, it's been just about 2 months since they opened their doors. NPR's Anya Kamenetz is in New York. She's following this story step by step. Hey, Anya.
Hey, Mary Louise.
Details on this announcement today.
Sure. So Mayor Bill de Blasio had kind of teased over the weekend that we might be getting very close to the threshold of closing schools. So today, the city's reporters and an untold number of parents were kind of waiting around. There was a press conference that was delayed for 4 hours. After 2 p.m., the school's chancellor finally sent an email to principals saying schools are going to close as of tomorrow.
Wow. And why now with so little notice? Parents finding out this afternoon there's no school tomorrow.
Yeah, so when the new school year officially began in September, after 2 delays, a lot of reversals, the mayor then set a benchmark that when and if the city reached an average 3% positivity rate on all COVID tests across 7 days, at that point schools would automatically all close again. And we hit that benchmark just in the past few days. Now, 3%, is a pretty low number. It's the most cautious threshold recommended by the CDC in its school reopening guidance. It's far lower than other places where schools have remained open. And I should mention testing within New York City's public schools has shown very few cases.
And I should clarify, when I say no school tomorrow, I of course mean no in-person school on campus in the classroom.
Right.
How does what is happening in New York compare to what is being done elsewhere in the country, Anya?
I've been tracking this. There's different organizations tracking this. I have to say, it feels at this moment like the trend is toward closure. So besides New York City, the governor of Kentucky announced today that schools were closing. Denver public schools also closed today. I think one headline is that with community spread out of control in so many places, even the cities and states that had opened all their schools up, in some cases are having to close back down because contact tracing and quarantining are taking too many teachers and staff members out of commission. Essentially, they're running out of substitutes. Another really interesting indicator from an organization called Burbio is that we're seeing urban school districts especially likely to be all remote. So that's not only New York City, LAUSD and Chicago have been remote this whole time. Detroit just closed its doors, and more recently so did Des Moines, Iowa, Toledo, Ohio, Oklahoma City.
Wow. And I'm just thinking about the impact of all this on real people, on students, on their families.
Absolutely. And, we should really underline that these impacts are not going to be felt equally, right? The AIRS research shows with these urban school districts that are more likely to be remote, that means often districts that are a majority low-income students, majority Black and Latino students, and that all describes New York City. And, these are the very same students who are less likely to have access to the internet, to devices, to at-home support to be successful in remote learning. New York City is a rich city, but Chancellor Richard Carranza, for example, announced today, after all these months since schools closed in the spring, that they're going to be sending home paper packets tomorrow with some students because they still haven't hooked everyone up.
And just briefly, parents, where does this leave them?
There's some room in the Learning Bridges childcare program, which is free and open, especially to essential workers. So we're going to be looking at that and what options working parents have.
NPR's Anya Kamenetz. Thank you, Anya.
Thank you.
The U.S. has reached 250,000 official deaths from COVID-19. That's more than 5 times the number of Americans who died in combat in the Vietnam War. 250,000 lives in context. Tomorrow on Morning Edition, ask your smart speaker to play NPR or your station by name.
Oh, little boy, look at that. Got some more ribs. Some ribs. Some coriander. She said, I'm done with the plastic tarps, man. So we're going to do that like such. I was waiting. It's going to be nice. Have a sunroof. Simplicity. Love the life you live. And enjoy every moment. Romeo and the cat still order. So I haven't seen the black cat since that day, man. That was a trip. Just not sure if we got 2 cats or we're hallucinating that, but I know I got it on video. I don't know. I'll go to the med tent. I'll be back.
There's so many people that love cats that we can just make a Romeo channel.
Romeo in the Wild.
Wilderness.
Yeah. Romeo in the Wild. Yeah, I ain't seen that black cat since that day. That was a trip.
We were able to stay ahead of our curve and keep transmission low. Today, in a more focused way, based on many things that we've learned over the past many months, I'll go over those things in just a moment. We are putting forward a limited stay-at-home order, one that is more targeted, one that is more focused in the following ways. It impacts counties that are in the purple tier. You'll remember on Monday, we announced 41 counties across California are in the purple tier. Today, we are not announcing additional counties in the purple tier. In fact, over the past 48 hours that we've looked at the data, no county across California has moved to a more restrictive tier, and certainly no one has moved to a less restrictive tier. We're asking that as part of this targeted, limited stay-at-home order, that people are home by 10 and stay home until 5 a.m. This means that many essential businesses that we've in the past called non-essential businesses, there's a list of what's included and not included in that category, that we ask that they close operations by 10 p.m., that people can get home by then, and that they stay home, and those businesses don't resume operations till at least 5 a.m. throughout all of the purple counties. This order, this public health order that will be modified at the state level, will be effective November 21st, so that's Saturday night at 10 p.m., and will go until December 21st at 5 a.m. So what does this mean practically? I'm sure many are asking what this means. I just wanted to highlight a few things at the top. I know I'll get many questions on this and look forward to answering those. But what does it mean that you can still do? So I think about my own life and often the need with 4 young kids to make a late grocery store run to make sure we're stocked for breakfast in the morning or a meal. And yes, it does mean that I could still go to the grocery store at 11 if that grocery store is still open to pick up milk or eggs or whatever I need. My dog doesn't walk very well, hard to get around the block. But yes, I can walk my dog at 11 p.m. if that's your tradition and routine. And for restaurants that close their front door at 10, doesn't mean that the back door to do takeout and delivery is closed. And so we urge people in a limited way to use restaurants in that way. And for all you restaurant operators and owners, that's certainly an opportunity to keep some amount of business going. And why are we doing this, and what are we hoping to gain? It's really to avoid further restrictions. We know, and we've seen in the past, that COVID goes from 0 to 60 miles per hour very quickly, that we're in a place today, but that can rapidly change. Maybe not statewide, maybe just in a handful of counties, but further restrictions is what we hope to avoid. But all tools are on the table. We have sort of that top shelf of the toolbox. We continue to use those tools, but on that bottom shelf, if necessary, we will explore further restrictions. But we hope today's actions, our collective coming together, our resolve to, keep our protective behaviors up will help us stem the tide and bring these surging numbers down very, very soon. Again, some reminders of why we're doing this today. Why now? Well, we want to keep the highest risk individuals safe. We know that although many people who might be out and about, even between 10 and 5 are not the most vulnerable, not our oldest Californians, not those with underlying chronic conditions. That said, we know that those who are out, who might be engaging in higher risk behaviors, that those infections can quickly spread to other settings. Maybe you're a worker who's out at night with a group of friends, outdoors even, and you contract COVID, and then you go the next day to work and it is passed on, maybe not the next day, but a day or two later, to a vulnerable resident in a congregate care facility. Exactly the situation we want to avoid. We've learned very clearly that it's not just about our own personal COVID risk, but it's about the risk that we infer on others around us because of our choices and behaviors and actions. This is, of course, to keep essential workers safe as well. Those who continue to pick our food, sell our food, prepare our food, and many other essential workers across the state, allowing them to come to work with confidence and safety, part of the reason why we do this today. We continue and haven't over the last week or two, but it's always front of my mind, the disproportionate impact of COVID. And as we see cases surge, that disproportionate impact still holds. We will see brown and black communities across our state disproportionately impacted, more Latinos, more African Americans, more of our Asian neighbors infected because of some of those conditions of work and other situations. And we want to make sure we do all we can to support and protect those populations. And frankly, this is going to help us stop the surge faster and avoid more severe actions and restrictions, as we've talked about. And ever so important to remind you that our hospital capacity, although we did a tremendous job preparing and have those resources in place, some have been activated, many wait to be activated, but we want to make sure we protect that hospital capacity so those who need care get it, and get it in a timely way and in a way that's high quality so they get all of the benefits that they can. So California, as we've reminded before, we were the first state to do a stay-at-home order. We saw its impact back in March, those difficult days adjusting to the reality of COVID, but that kept us ahead of the curve. While other states were experiencing high rates of rise and were working on flattening their curve and their transmission, we really didn't in March experience that radical rise. And just like then, today's actions will help us bring down transmission and flatten our curve, this time in a very important and urgent way. This graph, we haven't shared it in many months, but we showed you back in March that without an intervention, we see these rapid rises. And yes, it comes down, but after a really important toll on all of Californians, that without interventions, we see high case rates, high impact on our hospitals. But with interventions, with the things that we're emphasizing today, along with the many other actions that are already in place, that we can bring this curve down, we can flatten it, we can get it to a point where our healthcare system is able to do what it's intended to do, which is take care of the sick in a high quality and complete way. I wanted to remind people, because today I've already gotten questions, our own team talked about it. Why are you focused on the time period from 10 to 6? Why are we not doing what we did in March, as we have significant concern around surges? Well, we've learned a lot, and we've been a state that has been guided by data, guided by science, and in that data and in that science is a great amount of learning and refining our thinking, focusing on our interventions in a way that allows us to be more targeted and do things not in all tiers, not at statewide, not for 24 hours of every single day, but in more focused ways. And what are some of those lessons? It's that masks do protect us, not only those around you, but the evidence is clear that they protect you as well. Moving things outdoors significantly reduces the risk of exposure and transmission. We've mentioned it already here. We've mentioned it for many months. Move things outside, keeping it short. Both of those things helps us reduce transmission. The whole concept of ventilation, about bringing outdoor airs indoors, even in canopied areas outdoors, making sure that we have clear and easy ventilation is an important feature to reduce transmission. We've learned that squarely, not necessarily in March and April, but really over the past couple of months. The other very important thing, no one knew this early on, that even those who do not have symptoms and look perfectly well are spreading the virus. You've heard about asymptomatic spread. You've heard about people who are pre-symptomatic spreading the virus.
If you're just joining us, you're listening to a live coronavirus briefing from Health and Human Services Secretary Dr. Mark Ghaly. I'm Scott Schaefer from KQED. Now back to Dr. Ghaly.
Take early actions. We must take actions that even if the impact is seemingly invisible to some because folks aren't sick who they're around, this fact is a very critical one that pushes us to take these actions now. And then importantly, and this has really been an important guide to me and our team here, clarifying that roughly 12% of today's cases will be hospitalized in the next 2 to 3 weeks. Since early July, we've been tracking this, and although in some parts of the states it's as low as 6 or 7%, other parts it's closer to 15 to 20%. On average, 12% of our cases will be hospitalized in 2 to 3 weeks. What does that tell you? It helps you plan based on what you're dealing with today in hospitals, today's cases, what the next 2 to 3 weeks looks like. And that helps us make decisions now so we can avoid some of those big surges in the hospital beds and the potential for not having the capacity that we've depended on today. So again, it's always important to emphasize what we can do to make a difference, to keep our schools open, to keep that economy operating as much as possible, and our healthcare system functioning. Talked about wearing that mask, wearing your mask, not just when it seems convenient or when it seems like you're around people you don't know, but as much as possible. We've updated our mask guidance, and we will update it again as we continue to evolve with the science and see opportunities to support additional masking across our state. Keeping your distance, spreading things out when you can, using the entirety of your backyard for a gathering, using multiple rooms when you're with someone else indoors, and spreading things out, I think, is really key to helping us reduce transmission. We've talked about the importance of circulation, keeping windows and doors open so outside air can come in, and frequently is important. Keeping things short no matter where you're together with others, keeping it small. We've talked about our California standard that no more than 3 households. This includes your own household, so it's not 3 others, it's yourself and 2 others. Important. And now today, underlined here, bolded here, gatherings shouldn't occur between 10 p.m. and 5 a.m. We know that's hard to imagine how to enforce. Some of you may say, well, how am I ever going to be known if I'm doing that at home? We've depended on a partnership with all of you. This is about coming together. This is about us deciding to do some things that sure it's an inconvenience, sure we may not want to for a short period of time so we can get this under control and hopefully bring rates down to a place where counties don't just stay in purple, move to red, orange, and yellow down the road. And it's always important to end these actions with an eye towards protecting older Californians and those at risk. I'll take this opportunity to remind you that even though only about 10% of California's cases are in individuals over the age of 65, 75% of our deaths, that worst outcome that we want to prevent at all costs, is experienced in that age category. So, no, I'm not going to give this presentation again in Spanish. I'm going to invite my friend and colleague, Dr. Gil Chavez, to share some of the same message here in Spanish. And then when he's done, come back to you, wrap it up, and take as many questions as we can from reporters. So thank you, and Dr. Chavez.
Muchas gracias, Dr. Galdi, por siempre darnos la oportunidad de comunicar estos mensajes importantes con la comunidad latina. El día de hoy quería yo comenzar.
Listen to the ignorance. It's crazy.
Yeah, Supervisor Phil Serta expressed concern that others will take the order less seriously, but in general, the county said they were leaning on education rather than enforcement.
How are other jurisdictions responding?
We're still gathering data on that, but in the Republican-leaning San Diego County, the sheriff there said he's dedicating 8 full-time officers to investigate health complaints and issue citations. Meanwhile, statements from the Sacramento and Roseville police departments say they will lean on education rather than enforcement, which kind of begs the question, how good will this order do in areas where there's all carrot, no stick?
Yeah. About 15 seconds left. What's the reaction been like on social media?
Real mixed bag. A lot of people still giving it to the governor for his fancy dinner, but others questioning the science and others saying, let's get on board.
Cap Radio's Ed Fletcher, thank you very much. It is 6:06. This is Cap Radio News.
Support for NPR comes from NPR stations. Other contributors include the Wallace Foundation, working to develop
stop
and
a
share
pandemic if nobody's on board to stop it.
and enrichment for young people.
Well, no, than at the beginning of the pandemic. But the testing infrastructure in this country still appears to fall far short of what is needed. We're going to talk about this now with the man in charge of testing in the United States, Admiral Brett Giroir. Welcome, Admiral Giroir.
Thank you for having me on.
Why does demand still outpace supply 8 months into this pandemic?
Demand does not outpace supply. In fact, we're doing over 1.5 million tests per day.
I just described.
Okay, so when you have people who believe they need to be tested, millions of people so they can go on vacation holiday, the system does not support that. We are absolutely able to support the testing of those who are symptomatic to all the contacts they have to test asymptomatic individuals across the country in an unprecedented way. We have all of that, but the lines you're seeing primarily now are the result of individuals who mistakenly believe that getting a test today or tomorrow is going to make them safe over the holidays for travel, and that's just not true.
You think this is a Thanksgiving bottleneck?
Oh, I think it really is a Thanksgiving bottleneck. We have almost double the supply of tests than we actually will probably do this month, as we did last month. We'll have over 70 million point-of-care tests this month, far more than twice the amount of testing that was done last month. We've already distributed 63 million of the Binax cards to individuals. So look, we are not in a situation, and we are not going to be in a situation soon where everybody who wants a test on every day can get it. But we have significant, robust supplies. We are testing all nursing home staff twice a week in hot counties and not hot counties once a week. We're testing 250,000 students at Wisconsin, surging in Utah. We have enough tests to do what we need to do with the testing side. What I want the American people to really understand, though, as you heard today, that we are in a dangerous and critical part of the outbreak. The numbers of cases were over 1.1 million in this last week. Our hospital admissions have gone up almost 100% in the last month. That is not going to be solved by people getting tested who don't need to be tested. It's going to be solved by mask wearing. It's going to be solved by limiting exposure to indoor crowded areas, physical distancing, hand hygiene, and unfortunately closing of some establishments or limiting the population of indoor establishments like restaurants
and you are
bars.
preaching a message that absolutely has been underscored, supported, and that public health officials would 100% agree with. Wear a mask, socially distance, do all of those things. But I have been interviewing those same
public health officials for months and months and months now. They argue that, to put this pandemic behind us, to keep the country and the economy safely reopened, you need to be doing tens of millions of tests every day. What is preventing us from doing that?
That is a physical impossibility. We
Why?
do not. Why? Is that sort of an existential question, right? Why can't people fly? Why can't these things happen? I mean, we have invested every single dollar that's possible into increasing the testing infrastructure. Remember, we only had a few thousand tests we could do a week. Now we're doing over 10 million per week. We have point-of-care tests, but we do not have the physical capability to actually have tens of millions of tests. The closest one is Binax, right? That's the closest one. That's $5 a test. It's very easy to administer. We are ramping from 30 to 35 to 50 million per month, but that's per month. There are not a world supply of the certain types of material that goes into that. We are doubling, tripling the swabs that are being made. It is no lack of will or money or infrastructure, but we're going from a standing start to where we are today, which is an unprecedented rise. I would love for us to have hundreds of millions of tests per month. There has been no lack of investment, effort, science, coordination. It's just
So
we're
you're
not
saying
there yet.
this is not a shortage of will. This is not a shortage of money. There are physical, just manufacturing impediments to this.
There are physical manufacturing impediments that can't be fixed overnight. A lot of them could be fixed over weeks. We went from being able to make a few million swabs a month to 100 million or so per month. We had no point-of-care tests, none.
Yeah.
Until having some, and then this rapid point-of-care test is here in the quantities of 35 or 40 million. But I do want to say, look, there is a possibility that in the future there's home testing for everyone and everyone can test every day. There's going to be
I
false
wanted to
positives
ask you
and
about that
negatives.
because that's a piece of news this week. The FDA just authorized the first test people can use themselves at home and get results right away, but it's $50 a pop and the supply is really limited. Do you have any idea when that will be more widely available and more affordable?
That particular technology is probably not going to be widely available, nor is it going to be more affordable because it's in a form that is not going to be affordable. It's expensive to make it. So the kinds of tests that we're talking about is like the Binax test, the $5 card-based test that we purchased 150 million of. It's first in class. There will be others that are similar to it coming down from other companies where there's independent supply chain like through Europe. So we do expect that, but we are not within months of being able to have hundreds of millions of these per month. So
I guess, forgive me for interrupting you.
No,
We
go
just
ahead,
have a minute or
please.
so
Yeah.
left, and I just want to get to this. The basic question that I can't get off my mind, this is a country that sent people to the moon decades ago. This is a country that in the same 8 months, 2 pharmaceutical companies have come up with a vaccine that they say is 95% effective. Why can't we get testing out there in the supplies that would allow everybody who wants a test to get a test?
So we've been investing in the manufacturing of these vaccines for about 20 years to get us to the point in time that you have an 8-month start and can get something going. There was not a single swab in the stockpile. There was no manufacturing chain. There was no industrial base. Okay. There was not a single diagnostic in the stockpile. No manufacturing chain, no industrial base. Okay. So this is truly a standing start. This is the equivalent of...
I'm sorry to cut you off.
Go ahead.
I know you're running fast, and we wish you luck. Admiral Giroir, thank you.
Okay. Bye-bye.
That is Brett Giroir, the testing czar for the White House Coronavirus Task Force.
Stay home for the holiday. The Centers for Disease Control and Prevention made that strong recommendation today to help prevent the spread of COVID-19. While a traveler would face fewer traffic jams and less crowded airports this Thanksgiving, a huge spike in coronavirus cases has already caused many people to toss their holiday plans, as NPR's David Shaper reports.
It's usually a pretty simple decision. Alita Nissen, her husband Dave, and their 14-year-old daughter pack up the car and drive from their home in Bend, Oregon, 3.5 hours south to Dave's mother's house. But this year?
We've been back and forth for about a month, deciding whether it's really doable.
On the one hand, it's a trip the Nissens take every year, and with the rapid spread of the coronavirus?
I'm more of the mind, let's skip. let's skip this year. You know, it's 1 year.
But on the other hand, it's been a rough year and a long time since they've seen Dave's side of the family.
When I look at the desires of my daughter and my husband really wanting to connect with this part of the family, that's really...
Morning, everybody. I get back from the post office. It's go time. Pick these up to a family member. Sumites. Guamanian side of the family. $150 for a full rubber team. One thing I miss about the shop, besides all the people, beautiful kids and everything, doing the wonderful barter trades. You need something and spirit would send the person in. Need something else. Beautiful. So they got the PG&E helicopter flying around. Chuma Mubarak, everybody. Got that mountain microwave going on. Getting it going real quick. The shelter. So just put a bunch of wet wood in there. About to deconstruct the evolution.
Issued mask mandates. They're not technically enforceable according to our Iowa code. But I look at the number of businesses that have the sign on their door, mask required for entry, and people are doing that in order to go into those businesses. So I think it's happened organically.
Ashley Hinson is the Congresswoman-elect for Iowa's 1st Congressional District.
Yeah. Songs on the front porch, kids. Like written to Obella after I come out of prison. My mind from being in a coma beaten into by the police. July 19th, 2014. Songs from the front porch. Evolution. From backhoes to chainsaws to building houses, baby. Siamo, man. Just trying to be a good husband. Lego blocks.
What? Sorry, just quickly. What if it's...
nice is the moon's right there. Alright, cleared out that stuff. You seen through the roof.
The Egyptian Initiative for Personal Rights, who have been arrested.
Got one end tacked up. Just bracing one side right now.
Rights group met with a group of foreign ambassadors and diplomats in Cairo earlier this month to discuss the human rights situation in Egypt and abroad. For more, we go to Cairo, where we're joined by Democracy.
Last boards are tacked up on this side, and then tack these, and then we do the top. Slope. Drop this down. Right. Nice flow. Go do the others. Nice and flush. Good flow. Ready to start putting the tops on.
I'm gonna have this view like this. That's insane. Are you ready?
See.
Studying the address, so 400 square foot. It's fucking amazing. That's how you got me, huh?
Sleeping in the well. You got me in a sense. I'm trying to get you to sleep outside, and you got me sleeping in the car. To now this, I guess compromise.
No, you're welcome. You're welcome to sleep out there. I'll be here.
I'll be like Romeo. Don't remember that. When I told you once I get done with your.
With your thermal. Dude, you're fucking crazy out here. You kidding
I
me?
told you once I'm done helping you with yours that I'm gonna start on my traditional Iroquois. All right, so I'll feed this over. That's all I was trying to pass it to you.
Huh?
So that's why I was trying to put one up there.
Oh no, hold on, no, because these are two.
There should be 3 up there. Getting it up. They're just talking and they're switching these out. I don't like that. I like the natural light because the sun's right there and it takes all of our natural light away. Plant life and stuff. And ability to see. Simplicity. Early stages in the video game as you build up and upgrade. We're gonna be changing these guys out. See through the roof.
We're going to come to Marysville tomorrow because they got those and it's cool. Now we can see how the boards are over there. It's okay. good. You can see the trees fucking dancing. Here soon we just replace those.
The water is running. This little ball pops up and starts doing this crazy star pattern in circles. It's the first time in my life I've ever seen that. Don't be shy. Come on, show yourself. Come on. Show everybody too. He's being shy. We'll catch him. We'll catch the Pokemon. We'll show you.
Is it the right temperature? There it goes. It's in a star.
That's crazy. This is straight plain old water.
It's just water. Yeah, no. It's building up. Because if you look, it's the water is like a little bit concave.
Mm-hmm. Like the plasma biology do. Like crazy surface tension. Rose tea. Vitamin C. Keep you healthy. Make a little quick overhang port for the excess. A little lip thing. Mob into town and grab some other materials. You're changing out those opaque for clear. Getting it dialed in. Moving these. We're gonna do the white on the bottom like the blue tarp and then turn on top. Getting it done. Coming together. You're evolving it. And take those white ones that were on, or white opal. Just put it around the edges and then be clear on top. Yeah. Gotta make another rim in the belly. Get more material.
You should do like the sequence pictures.
See?
I think I did like 50 orders.
When
it comes to run out of the red paper, they do it all day.
Dropping down the mountain. I'll get some more supply. I was talking about, man, it's gonna be expensive permanent semi. We're gonna have to modify it, and when we take it apart, put it together, do it real nice.
It's gonna be a really long 6 semi-months, you know.
Okay.
Shit, we're in November.
It's easy.
No, just a airbox.
Love and light, everybody. Stay safe out there.